Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back. And if you're joining us right now, we're just getting our first conversation started. Of course, we are bringing you our COVID-19 update for today. And this morning, we are speaking with representatives of the Ministry of Health just to talk about the year in review, looking back at the pandemic in Belize. And joining us this morning, we have Dr. Melissa Diaz-Musa, who is the Acting Director of Health Services. And we also have Lorna Perez, who is the Senior Surveillance Officer from the Ministry of Health. Good morning.
Good morning.
Hi, good morning.
And Happy New Year's Eve. I should start there as well, too.
Thank you, and thank you.
But perhaps we can just start with Dr. Diaz-Musa. You can give us a little bit or a brief description then in a nutshell of what 2020 has been like for the ministry in dealing with the pandemic, and before we get into some of the details, but how would you describe what 2020 has been like?
Well, I mean, I think for the all over the world and for many health teams, it has been very uncertain times for us in the Ministry of Health. Challenging to say the least. Our team have had to have a really sharp curve to actually adjust, be flexible, learn new things, and make changes as it became necessary. So definitely it was a year that has been, it is a year still that has been different than any other year for us at the Ministry of Health. And the team had to pull together and really encourage each other and make the changes necessary for us to continue to give the health services to our population as we are supposed to do.
So let's talk about the efforts of the Ministry of Health. You know, we've been talking about COVID-19, and I think as we look back, there's so much more that we know now, even though there's still a lot more that we are yet to understand about the virus. Let's talk about some of the critical things that we were confirmed this year that we can say with certainty about COVID-19.
Well, I mean, we do know that late December, the first case was identified in Wuhan. We do know that, well, it's a brand new virus. It mutates like many other viruses. It has a wide array of symptoms, and you can from being completely asymptomatic to they're mild cases, moderate cases, and of course, very severe and critical cases. So there's a wide spectrum of different symptoms as well. And as we learn more about the virus, like you quite rightly say, it is more different symptoms come up. Initially, we thought it was just flu-like, so a cough, a cold, difficulty breathing, fever. Now we know diarrhea and vomiting are key symptoms. Many persons describe severe back pain. The mental aspect of it as well has come to the forefront. So there is a wide, there are many different symptoms from this virus, and there's a lot that we're still learning from it. For instance, it's a virus that it can be completely asymptomatic and you can be transmitting, which is very different than many other viruses. The influenza virus, for instance, you transmit it when you're actually symptomatic. With COVID-19, we do know that you can be infectious even prior to your symptoms coming on. So in your pre-symptomatic stage. So all these things are very important to help us to reduce the spread and to help us to ensure that we control the spread of this virus in Belize.
Yeah. We've at least learned some of the preventative measures as well. I think I remember very early on where we were debating masks or no masks. Now we know unequivocally that masks help both the persons who use it and, more importantly, for the people you're around.
That's right.
Looking back, though, and you know, when you try to think of all that's happened in this year alone, it's a lot. But Dr. Diaz, for example, and you as well, Lorna, you know, we started talking about this early on from when we were doing the strengthening of the measures at the airport and travel bans and lockdowns. Let's go through that timeline. I know we have a slide we can use.
Yes, we can look at if you want to bring up the slide.
Yeah.
It tells us about the timeline. Well, it's difficult to see at.
So we started with the screening at the airport in January.
Yeah, well, in I have it here on my phone. On January 24th, well, we've always had public health inspectors at the airport, but on January 24th, we placed nurses at the airport, and that was to increase the surveillance that we had at our borders. So not only at the airport, but at the land borders as well. We created different surveys and questionnaires and started to do the temperature checks, etc., for us to try to pick up if there's anybody entering with this new virus. So that started January 24th. And really from January 24th to now, it has been just a blur. We've just continued to work towards trying to reduce the spread of the virus and trying to educate the population and trying our best to do the management that's needed to reduce the spread of the virus. So in January 24th, yes, we started the screening at our borders. We continued on, and on March 11th, the WHO PAHO declared a global pandemic. On March 20th, we had our first case in Belize. And at that point, from April until June, we would say that we went through our first outbreak where we had 18 confirmed cases that we were managing. A lot has changed since then. We know that I think April 1st, we had the state of emergency and the complete lockdown in place. We do know that March 23rd, we closed the international airport and land borders. I think the land borders were closed like a week after. So these were certain things that we were trying to do to ensure that that we controlled the spread in Belize. So from April to June, that's when we started to do the repatriation. And I think the first repatriation started in the end of April with the cruise lines. There were 3 different cruise lines that brought in Belizeans, and they stayed in quarantine. And then in the middle of June, we started the repatriated flights from Houston into Belize. Total, I think that continued from June to September 30th. And we repatriated about 800 passengers from the airlines during that time. And then, of course, October 1st, the airport reopened. That's
when you put it into perspective, the first wave, which was very early on, we detected our first case in March. We went into lockdown in April. And interesting to note, we locked down after the 3rd confirmed case. And during that lockdown, they detected up to 18 cases, which recovered. And I think we had 50-something days where we were saying we were COVID-free or there were no active cases. The second outbreak, I think looking back at that, what do we know now about how the virus was reintroduced back into the community? Because land borders and the airport were closed.
Yes. Well, from the repatriated flights, just to give a little bit of data, we brought in 800 people. Everybody had remained in quarantine for 14 days at that point at the hotels in Belize City. And we picked up 15 positive cases with the repatriation. Now, when the country started to open up in early July, we do know, and you all would remember, the border jumpers started to come in, and we slowly started to pick up cases then, the border jumpers. And then the outbreak really was seen first in San Pedro, and was, I think, at the latter part of July. And it just continued to escalate from then, because then it went from San Pedro to the northern districts, or a combination of the 2 areas. And from then it just continued to spread with the country being open and movement. We know how the virus is spread. So the more we move, the more we socialize, the more we interact, the more we will see increased cases.
And Lorna, I think that's part of the interesting thing when we look at the data for Belize. There was all this talk of flattening the curve internationally, but we didn't have that regular curve. We've just seen different spikes throughout the year. Do you want to talk about that, Lorna?
You're referring to the earlier part or the second wave as you
The second
referred
wave,
it?
because the first we went to 3, then 18, then it stopped.
If
Yeah.
you notice at the pattern of that second wave, I think Mr. Hager will be able to actually, when he did his analysis and you look at the data, that every 2 weeks almost you had a little spike, a wave, and that just takes into account the incubation period of the virus. So we started in July noticing the increase in numbers, and you started to follow the cases and do your case investigations. The movement was so broad, I would say, that there were many that you could, in the data itself, it was showing you that movement. So if you follow the curve, you will notice that there are certain patterns. There's a pattern that you can follow then.
Yeah.
But I'm not sure if your question was referring to what we were observing or what really was happening on the ground per se, Marlene.
Well, I mean, what's the difference? Wouldn't it be the same?
No, the difference in between the first and the second wave, definitely not. I mean, it was a more controlled environment, I would say. With the first phase, we had, because of the actions that were taken earlier on, then, the actions that were taken was more manageable. It was manageable then when you look at the numbers then, as compared to when we look at the numbers afterwards. So when you look at that, at the response in regards to the cases popping up, there were, I think, when the numbers, the movement were so much that the numbers then just went up quite drastically in a few weeks' time.
Yeah.
We were seeing some higher numbers. And again, as I said, the virus is so interesting when you look at it because of the asymptomatic cases. When you're doing surveillance, you do what we call passive and active surveillance. So during the time, as you rightly said, there was that time period when we had no cases. We were reporting no cases whatsoever. And then all of a sudden, we started picking up the cases. And this is because people were symptomatic and coming in. So the amount of asymptomatic persons that were there that were not being screened, then that was just giving rise to more people being exposed. So I think that was, when you look at the difference in the first wave and the second wave, you find that there was active infection going on.
Yeah.
And at the point that we caught it with the symptomatic, then that is when we started to implement our containment measures.
So most likely, before we started to see the wave of the newly detected infections in July, it was already moving around the country.
Yeah, I suppose when you started seeing the first case, it
Yeah.
was not really like the first case.
Yeah.
I mean, it was the first case that was detected.
Yeah.
So there were definitely other cases already around, and it is just that this particular one was developed symptoms, sought medical attention, and was identified. Because there are many other people, who are symptomatic and they were just handling it like a flu.
Yeah.
And, that takes maybe 1 day, 2 days, and after that they're over the symptoms. So they never do seek medical attention. However, that does not mean that the infection is not being spread by those persons if they are not taking the necessary precautions. So I think that is the difference when you look at the first wave, that we were actively searching for the cases. We were at the airports, as Dr. Diaz mentioned. We were at the borders. Even with the border jumpers, they were trying to identify early on who were the border jumpers, trying to get to them earlier, trying to put some measures to control. But that is an active, that's an ongoing activity then that is very difficult to control because of all the other implications with with the activity itself. I mean, the economic implications for people. So, people take risks and they go across the border. And it is very difficult for you to identify those because at the legal entries, well, I mean, we do have access to them.
Yeah.
But at the illegal points, that it's much more difficult. So by the time we picked up the first case, there more than likely were other cases around. And when we started to actively then look for cases, that is when you saw the numbers started coming up.
Yeah. And I understand Antonio has joined the conversation. Antonio Agar, who is an epidemiologist with the ministry.
Yes, he is.
Okay. Antonio, can you hear us?
Yes, I've actually been listening for quite some time now. Yeah, sorry I couldn't join you at the beginning, but
Yeah.
I'm here.
Okay, so you don't have your video on? If you can get that.
No, I don't have video, but I do have access to my computer and I can share slides if you guys want at some point.
Fantastic. So you can go ahead and respond to the question, because I was saying the what we have seen in our reports and the information from the Ministry of Health is that there's been continuous spikes. We see a peak and then it starts to slow down and then another. And your data, as I understand, supports that.
Yes, that's correct. Well, I could go ahead and explain, but what I would want to quickly ask is, could I share my screen?
Yes,
absolutely.
we're going to work
Okay.
on that. But go
All right,
ahead
so
and
just
talk.
let me just pull up the file and I will be sharing that with you in a minute.
Yeah. So go ahead and explain to us in the meantime.
Yes, so that is correct, your observation, and I would also support what Nurse Perez has said in terms of the overall trend and in terms of there being several smaller waves that have passed through the country and different communities in the country, because obviously different communities have experienced COVID at different points in time. And that is actually consistent with what we see with data internationally as well, because COVID, as was rightly mentioned, is not a disease that passes through a community only once or through a country only once. There's actually several waves depending on who becomes infected at what point in time. And obviously, if some people didn't get infected in the first wave, they might be infected in subsequent waves for as long as there are not, adequate intervention measures to actually bring the virus under control. So that is what actually we have been seeing in Belize and seeing across the world. Hence the reason why many countries have been going in and out of lockdown. And as a result of that, until we actually have either herd immunity brought on naturally by most people being affected by the virus, or preferably, as is now happening in many countries around the world, through mass vaccination, there will continue to be many waves, barring any strong intervention or barring any type of lockdown. But of course, even in very wealthy countries, as was mentioned by Nurse Perez, there's only so much that can be done in terms of these lockdowns that basically cripple economies. I would like to say that I am ready to share my slide, but unfortunately I'm not being allowed to.
All right, we're working on that. So, but
Okay.
the question I was going to ask was whether or not the 2-week cycle that was mentioned. Tell us a bit more about that.
Okay, yeah. So there is a 2-week cycle because, again, going with the international data and there being no major difference here in Belize, what we note is that the virus basically has a 2-week reproduction cycle, whereby in the beginning phase of that, as was mentioned earlier by Dr. Diaz, there is an asymptomatic phase whereby persons are still able to actually transmit the virus to others, even though they might not even go on to develop symptoms themselves. They very well may be carriers. And so as a result of that, that then moves on to this symptomatic phase, which generally for most people would last anywhere between 5 days to 7 days. Of course, it varies greatly depending on the person's immune system. Some people might be feeling signs and symptoms even well past the actual recovery stage. And then finally, that mentioning recovery, that brings us into the recovery stage. And what we do at the epidemiology unit is basically look at the overall trend in the data, and specifically in the case of Belize, from the analysis that I've done, what I've noticed is that in the case of Belize's data and our recovery time, A person generally takes somewhere between 16 to 17 days on average to recover. Not including, of course, like I said, the exceptions to that rule, people who, because of weakened immune systems or underlying conditions, would take upwards of a month to get better. But 16 to 17 days is generally the average of how long it takes. And so that's generally speaking the timeline, if you will, of the virus in the country. And hence the different waves that we have been seeing that have been popping up.
Yeah. Now, behaviorally speaking, and whoever feels comfortable can answer, when you have a country that's waiting on daily reports and we monitor, today 70 sounds like a lot, tomorrow 30 sounds like a little, then, 200 on another day, how much do you think it affects the behavior of individuals? Because if we are following this 2-week cycle, then it seems that, the numbers go down and people get more comfortable, then we see a spike. Dr. Diaz, you want to take that one?
Yes, yes. I think that definitely the numbers do affect behavior, and we do know that behavioral change can take a long time. We're social beings, etc. And if you see that the numbers are going down, it might make you feel a little more relaxed and more able to do certain things. However, at the Ministry of Health, we've really been discussing a different way of reporting the data, an easier way for the public to look at it. And when we look at data as well, we shouldn't really be looking day by day, but looking at the over the 2 weeks, like Mr. Agar is saying, and to get more of an average of what's happening in the country, because we look at different communities, different districts, etc. But for this reason, we have put in the public health measures. And I think that it's very important to talk about these measures with the public to ensure that, as I said, we know how the virus spreads. So if we can adhere to the public health measures, we can help to control the spread of the measures. So even if someone feels that, okay, the numbers have gone down, so now I can go out, now I can socialize, the measures are there to help us to stop that. As Ms. Lorna and Mr. Agar says, because of the incubation period being so long, and because of the asymptomatic carriers or the pre-symptomatic spread, we really can't say that, okay, in the next 2 weeks, there will be no cases or a reduction of cases unless we really put measures in place to reduce movement. So I think it's important that the data is out there, yes, but when you look at data, and Ms. Lorna and Mr. Agar could tell you a lot more about data, because many days even we would call at the epi unit and say, let's discuss this or look at how this is being reported. And for January, we hope to make some changes and to remove some of the numbers that we feel might not be necessary on a daily basis. We want it to be that if you look at the numerator and denominator, it adds up and it's simple. So there's some data for us, of course, that we need to monitor, and then there's data that the public should be able to follow as well.
I also wanted to ask about a very important issue because, and that's talking about testing. Because of course the data that is produced is dependent on the tests that are done. Now, one of the biggest issues, especially in terms of the second outbreak, and is that people have said, or people have stated that in some cases, waiting times between testing and getting the results there has been delays. And because of that, while people are waiting on the results, they may be positive, but because they don't know, they may be going about their activities, continuing to spread the virus. So can you respond to one, whether or not you can, the veracity or to the extent to which that is true, or that may account for the spread, and two, if there have been any sort of measures put in place to improve the time that people can get results, or other alternatives that people may be able to access to get faster test results.
Yes, absolutely. That was definitely a challenge for us, especially in the end of October and the month of November. We noticed that our waiting time for results had extended up to sometimes 13, 14 days. And we know that that is not the way that we wanted to go with the testing. Of course, our aim is to detect the case early, isolate early, and implement early management for these cases. So if you're waiting for so long, many people were placed in isolation, but it had caused a lot of frustration. So a lot has been done to alleviate this. And actually now I am happy to say that the Central Medical Lab is able to report swabs within 48 hours. So if you speak to people who have been swabbed within 2 to 3 days, the swab results would be there. They would be called and given their results, and the management is done as well immediately. What has helped us, so some of the measures that we've put in place the rapid testing, the rolling out of the rapid test drives all over the country. We've also collaborated a lot with the private sector as well to help with rapid testing, and we have at least 4 private facilities doing rapid testing regularly and adhering to the guidelines and doing the same advice as the Ministry of Health. So all of this has really helped us to reduce the number of PCR swabs going to the lab. But something that I really want to touch on and just make the clarification, which I did again yesterday, was the clinically recovered definition.
Yes.
And this is very important because I think that perhaps there have been some misunderstanding about this. There was a significant backlog because we have been reswabbing. And as Mr. Agar said, we know that between 17 and 21 days, that's the average day for somebody to recover. So when we're reswabbing people at 14 days, they kept coming back positive, and then they go back into isolation. And then we reswab at 21 days. So some people have actually had 6, 7 swabs before they receive a negative test. Now we do know, after a lot of research and many studies, that the virus in mild or asymptomatic persons is no longer considered to be infective if 10 to 14 days have passed. So it was important to make that clinical recovery formal, official, and the memo that was sent out was actually sent out to the regional management team. So this was not sent out to the public on a whole. So it really doesn't mean that, okay, I'm at home in isolation and now on day 14, I have recovered. That's not what it had said. So there were different criteria to determine whether you have been clinically recovered. We do know with COVID-19 that the majority of cases, so about 80% of our cases are mild, and the other 15 would go into moderate or severe critical cases. So at day 14, we are asking, or we would call the person who is positive and ask them to come in to be assessed. And with the assessment from the medical doctor and the vital signs from the nurses and the consultation, then a determination is made whether you have clinically recovered. So this isn't something automatic.
Yeah.
And so that's what I really wanted to make sure that employers are aware, that the general public is aware, that not because I'm on day 14 now, I have recovered. And also when we talk about clinical recovery, and I had put it on this slide, but I really wanted to read it out. It basically says persons with COVID-19 who presents with symptoms and were directed to isolate can discontinue isolation with the following. And it says at least 14 days have passed and the person has been at least 3 days, so 72 hours, without any fever, cough, shortness of breath, or any symptoms, and other symptoms have improved, like fatigue, headache, loss of taste and smell. So there are certain criteria to say that you have recovered.
Yeah.
Persons who have severe symptoms, now this is very important. So persons who have been hospitalized, persons who have more severe symptoms, they cannot say that on 14 days they have recovered. It states clearly here that these individuals will need more than 14 days, and in such cases, extensions can be up to 30 days in order for them to continue isolating and continue recuperating. And these individuals must be checked by a physician, and we've said day 7, day 14, and then day 21, and in between, if necessary, of course, if they worsen.
Yeah.
So it was mainly persons who have mild symptoms or asymptomatic persons who at day 14 would be asked to come to the facility and get a check and get a release letter. So I know many employers had called to ask about, my staff, it's day 15 now and they haven't returned, so I had to keep explaining. So I really wanted to use
So it's
use-
not just that you pass 14 days since testing positive and then you go back to work and resume. You actually do
No.
have to get a notice from a doctor,
That's
and
right.
they ensure that you have no symptoms, and that you are in fact cleared to go back to work. What has been removed is the retesting process.
Well, we still do retesting, but it's of a certain population. So we
Okay.
are reswabbing anybody who has been hospitalized. We're reswabbing anybody with moderate to severe symptoms. And we're reswabbing 5 to 10% of the general population for surveillance purposes or test strategy, just to have the information with regards to when laboratory confirmation of recovery is on average, how many days we need to find that.
To know a bit more about what's happening here.
Yes, yes. So that's really important, and I want the general public to know that it's not just for them to go back. We know the
Dr.
recovery
Diaz?
can last very long, so it's really important that that's stressed.
I know a lot of people just naturally they've been really conscious and aware of all the changes that take place, and this year has been, there are a lot of changes that happen.
Yes.
But this recommendation specifically is actually one that the World Health Organization had updated in their clinical care guide from, I think, as early as May.
That's right.
Yeah. Yeah. So this is a part of the guidance internationally that's being recommended.
Yes, yes, and many countries use different days. In fact,
Yeah.
I have the excerpt here from WHO that says after 14 days, in the majority of positive cases, persons may continue to shed the virus and show positive results, but are no longer infectious.
Yeah.
This only results in prolonged isolation of patients who are no longer infectious to other persons. And this was the updated guidance in May 2020. Some countries use 10 days. Some countries, for those of us who have family and friends in the States and in Europe, they know that some countries use 7 days as
Yes.
well. But we have agreed to 14 days at this point.
All right, let's bring it back to. Thank you for that explanation, and I understand that has been one of the grievances that people have been expressing since it was announced. But
Yes.
let's get back to today's data and where we are. At closing off 2020, I mean, for me, I always use August 1st as my marker, and I can't remember the exact numbers, but I know it was somewhere around a total of 50 cases compared to where we are now at over 10,000. And so we've just seen so much. We've seen a massive number of cases detected. We've seen people hospitalized. We've seen the deaths, and it is very overwhelming. One of the things that I know is important to look at, and you can explain why and where we are today, is the positivity rate, is knowing the level of transmission that's happening in the country. And I think based on your cumulative data report, we're still somewhere around 20%, which is extremely high, as the ideal is somewhere around 5%.
Yeah, indeed. Actually, for us to say that we have the outbreak under control, you should have the ideal thing, as you mentioned, would be under 5%, right? And you have to look at so there are many factors. Again, as I said, the expansion of testing is actually to try to get a better picture of where we're at. We look at your positivity is based on the amount of persons that we are testing. And so I think the more people we test, that denominator gets bigger, and then you get a better reflection of where we're at. The criteria that we have established, for example, for rapid testing is very clear within the public sector, in that the person needs to be symptomatic, and the person is a close contact of somebody who is confirmed. That in itself, targets the very probable case, and so your positivity should be. Your case definition then is very sensitive in that sense that you're trying to get the persons that more likely would be positive. So that in itself that sensitivity of your case definition then targets the specific suspected or probable cases, and so that is good. But again, as you rightly mentioned, Marlene, then that makes your positivity look high because you're targeting the at-risk population. So I think with the processes of reporting, the delays in reporting, all these things also, that's why you see that level of, ranges within our positivity rate, because some entities, we have other entities now that are reporting with us, and they are trying to report all the positives first before they report all the negatives. And so sometimes you see that shift in the positivity rate. But indeed, when you look at the bigger picture, the overall picture of having a 28% positivity rate, it could be one, we are really doing good targeting of the cases, or indeed the infection is that high in the general population. But until we do that big coverage with testing, then we will know definitely if where we stand with that. I don't know if Antonio has anything to add to that. Antonio?
Only to agree that the international standard, like you said, for determining that the outbreak is coming to a close is when we have a consistent, over 2 weeks actually, positivity rate that is below 5. And we are not there yet, but we are very much in the process of getting there. So as the data shows, and as I would like to speak probably in the course of this interview, our data is encouraging in some respects, but there is still a lot of work to be done.
And well, perhaps we can then speak to the way forward and on the work that does have to be done. Probably Dr. Diaz-Musa can take this one, but knowing what we know now, all the data that we've gathered, and also based on the improvements that have been made locally, what can we expect for 2021? And are we in a mood, or are we in a position to be optimistic as we go into the new year?
Yes. Well, definitely everybody's talking about the new norm. And that is definitely where we are at this point and where we hope to continue in 2021. As there is no cure to this virus, and at this point, the prevention is, as they say, better than cure. So the preventative measures will continue to be stressed. We do want to do, as Ms. Lerner was talking about, a full rollout of more testing, not only for yes, right now it's very true, we're focused on symptomatics and close contacts especially, but we have discussed looking in at other high-risk groups, businesses, the soldiers, police officers, so to get a wider perspective and understanding of exactly what's happening in our country with this virus. So we hope to do that in January 2021. We've also started late in December to assist the persons in isolation and persons who are positive with the food baskets and being supportive with phone calls, the mental health aspect as well, getting our mental health team together and supporting persons who are positive or who have recovered or who are isolating at this point, because it's very difficult to be alone for a long period of time. It's very difficult for us to stay at home alone for 1 day or 2 days, and imagine 14 days. Yeah. So there is a very significant toll when it comes to the recovery of both of physical and mental recovery as well. So we also hope to continue to collaborate, and we've had such good collaboration this year with a lot of our partners, the private sector, as I've mentioned, the private sector in health, and also other partners who have showed us a lot of, who have actually helped us with supplies, with staffing, with a lot. So we've got to be grateful for the country coming together and even foreign partners helping us as well. So in January 2021, we are focused on improving our contact tracing, improving our detection, rolling out more rapid testing, the health education, just really trying to do a lot more with health education, something interactive as well. And especially looking for us to try to get the vaccines as soon as possible. And just to keep in mind that even with the vaccines, we still need to keep our preventative measures as best as possible. We still have to help each other out in terms of reminders of what is the correct thing to do and how we and protect our vulnerable population as well. So
and even those who've recovered from the virus must still continue to use the measures.
Sorry?
Even those who have recovered from the virus.
Yes, absolutely. Yes. Because this virus, as you quite rightly said at the beginning, there's so much that we still don't know. We've got to look at reinfections. We've got to look at how long you've got antibodies in your system. So many things. So we still we still try to target the public health measures, the preventative measures as the number one way for us to try to reduce the spread. And as Mr. Agar said, the numbers are promising, but definitely we've got to ensure that we continue to do the things that we are doing with regards to the public health measures and continue to work as a community to help each other out in order to reduce the spread.
Now, from the policy level, and I know that this is something that has been discussed before, is there any plan or have you engaged at the level to make decisions as to rolling out definitive phases for the country? A lot of other countries have it, and people begin to know that once you hit this marker, these are the restrictions that come into place. If you hit this marker, it gets even more restrictive, kind of allowing for some level of predictability for businesses and the public alike. Have we made any decisions in moving in that direction?
Well, yes. Well, with regards to that's more like the tier system,
yes,
or the different levels, yes. And we do have a plan, and we have a surge plan based on the positivity rate, based on the numbers of cases, etc. But that's more, the plans that we have is more so what we will do in the Ministry of Health with regards to our hospitals and our outpatient clinics and management of different cases. But we are looking at the tier system, and on a whole, we have gotten definitely from the persons working at the Ministry of Health policy level, as well as the medical response team, the tier system might be the way to go in the next few months. And like you said, it would give more of a standardized outlook on what is expected. If we do see, okay, tomorrow the cases have gone up to this, then businesses, employers, everybody would have a good idea of what to expect in the next few weeks. The SIs help us with that as well, with regards to trying to inform the employers and the general public on a whole of what's expected in the next few weeks in terms of the measures.
Now, do you expect that you will see a spike in the next few weeks, given that we are in the middle of the holidays?
Well, we do know that with any event or the holidays, I am hopeful that we won't, because there are measures that are in place and people are doing more to respect these measures, and we appeal to the general public out there, especially over the Christmas season, and today it's New Year's Eve, to continue to respect the measures that have been put in place to ensure that they protect their vulnerable family members, reduce socializing. So it's a combination of factors that we hope that the numbers might not go as high as it has been before. But yes, definitely we expect little spikes in 2 weeks after any big event. But we're hopeful that it won't be at the stage that it has been before.
And speaking of the tier system or things which may be appropriate, looking forward, can you also speak a little bit about, we're talking about, these measures as they would relate, to the entire country, but as we know, different parts of the country may be affected in different ways, and there may be the severity of an outbreak in one location may be different than the other. Yeah. I'm wondering, one, how the ministry has been monitoring the spread sort of countrywide, and how, it has been necessary, or how they've been choosing to implement whatever measures may be appropriate for a particular community.
Well, I don't, Mr. Antonio, do you want to take that, or Miss Lorna?
Well, I'll just add before Nurse Perez speaks a bit about it from the surveillance aspect, because there is the data analysis aspect and also the on the ground aspect. So looking at it from the data perspective, yes, you're absolutely right in that COVID does not affect all communities at the same rate or at the same time. Obviously, the northwest of the country, specifically the areas bordering the river along the Mexican border, were the areas where COVID was more than likely introduced, or reintroduced, I should say, around August. And they have subsequently been some of the hardest hit communities in the country. Of course, other communities have also felt the brunt of COVID. So yeah, it's disproportionate in the communities that it affects. At the moment, the latest data as of yesterday is still showing that there are communities in the north that are disproportionately affected, that have a higher rate of COVID infection, both prevalence and incidence, as well as compared to the rest of the country. Most of these are in Orange Walk, but a few are also in Corozal district. And the new area that is coming to our attention is actually the Banana Belt in the south. Previously, this had been an area that was spared, so to speak, but recently there has been introduction of the virus through people basically traveling throughout the country, trade and business, various reasons. And basically that has resulted in there being many infections in the communities in and around the banana farms. It is something that we are definitely looking into. There is ongoing field investigation into these communities, precisely because they are so interconnected. So even if people don't necessarily travel and visit one another from one community to the next, even if they're abiding by the SIs, nevertheless, the reality is that these people work literally side by side in the fields or in the factories or any of the processing plants. And so obviously there's room for infection, even with all of the prevention measures. So yeah, so the north of the country, primarily Orange Walk, and to a lesser extent Corozal, sorry, and the southern half of the Stan Creek district, particularly the Banana Belts, are the areas that we are focusing attention on right now, because these are the areas that have the highest incidence. Nevertheless, we don't take our eyes off the rest of the country, because if there's one thing that we've learned about COVID is that the minute you ignore it, the minute it starts actually growing and rebounding. So that is what I would have to say from the data aspect, and I believe Nurse Perez will be able to speak from the field epidemiology and perspective.
Well, just to add to what Antonio, yes, we are guided by the data in regards to what happens on the ground. And for the surveillance is ongoing. We have our teams out there on a daily basis, looking at what is really happening, reporting cases, conducting the activities in regards to surveillance. So we have always maintained, and as Mr. Agar rightfully said, with COVID, you can't let down your guard in regards to surveillance. We saw what happened earlier on in July, August. And so we have to try to be ahead of the virus. We cannot wait for the virus to find us. And so we have to go out there and actively search and try to implement control measures. So that is what is happening based on the data. We look at the areas that are being affected and try to direct the activities in those areas. And the activities, as I said, it's not only detection, but also containment and prevention of further spread of the disease.
All right. And the contact tracing, with more cases, it's a lot to trace.
Oh yeah, indeed. Well, Marlene, the first wave, when we were able to keep track of all of the contacts because it was so manageable. At this point in time, as I said, it's when you look at the human resource component to do all the contact tracing, it's it's really has been overwhelming for our staff on the ground. I must say, I must commend them for all the hard work that they have put in, because it has not been easy trying to keep abreast with all the demands that this pandemic has put on our staff. So I think contact tracing is an area where we need to improve. They are doing what they can with the resources that they have. But there is just so much that they can do. And I must say that they have done great in regards to that, to try, and you can see it with the numbers, as Dr. Diaz and Mr. Agar have mentioned. You know, it looks kind of promising there, and it's really dependent on what we can do as the response, and what the public does in regards to the, you know, to the spread, to the control of the spread. So I am really looking forward to having, you know, this little break that we're having right now with the numbers going down, that our staff can now, you know, do the catching up with all the data that with all the activities in regards to contact tracing that is presently ongoing. And I again, as I said, I can't express the satisfaction, at least from my part, in regards to surveillance, with all the work that has been done on the ground.
I think, and I think that that also brings up something which is pretty important, just for our viewers and the general public to be aware of. You know, speaking of the issue of contact tracing, and that is what the ministry's recommendations or protocols are for if somebody does have COVID symptoms or comes into contact with a confirmed case, what should that person do? So, for example, if somebody starts experiencing the flu-like symptoms, do they immediately go to the doctor? Do they call the ministry? You know, in the beginning of the pandemic, of course, there was a lot of emphasis on these sorts of protocols. But as numbers have risen and the spread has less contained, of course, that we don't know, or perhaps you can clarify what those are and whether the ministry is making those same recommendations, or if there's anything new in place that people should be aware of if they are experiencing COVID symptoms or if they've come into close contact with a confirmed case. What should they do?
Yes. Well, a lot has changed over the last 12 months, but what we know is very important. Our messages initially, we did the stay at home, etc.
Yes.
Now we're changing the way that we are approaching the public, and we have flu clinics set up all over the country, and we're asking the general public to, if you have symptoms, if you're a close contact, to come into the flu clinics, to come in to seek care, because we do know that early intervention will help for a mild case not to move on to a moderate or severe case. So we are asking now, if you do have any symptoms at home, don't just wait at home, but please come in to be assessed. There are certain things that we do know that sometimes persons might appear well or not seem as in distress. But when you look at the oxygen levels, etc., that might be dropping at home without that person knowing. So it's very important to come in, get your tests, get your medical consultation, get your health education, and start symptomatic relief as soon as possible. So that's one of the messages that we really want to drive home today. The persons at home, to please access care. It definitely helps you with even the symptomatic relief, and it helps you to get early care so that you might not need to be hospitalized.
Yeah, and definitely don't want to end up at the hospital in a critical state because you waited at home too long.
Exactly.
So
yes.
I appreciate, I mean, you guys have shared so much information this morning, and I think one thing that stands out is that while we are cautiously optimistic that the numbers are looking better today, the last thing you want is for that to be kind of a signal to people that it's okay to move around or to be less rigid with their protective measures. So in addition to testing and results and tracking data and contact tracing, there's also this public health message. I know that keeps on being the most important tool that you have. So Go ahead, Dr. Diaz, as we close off this segment and speak to our viewers about the need to keep, even though we're all tired and frustrated, to keep on doing what we need to do to stay safe and to get to a point of containment.
Yes, absolutely. I mean, a lot of people have now spoken about COVID fatigue, and we're appealing to the general public not to continue with your resilience. Don't get fatigued with the measures that have been put in place. We don't know how long we've got to do these, and it prepares us for any other viruses, outbreaks, etc., that may come our way in the next few years. Keep up with the public health measures with wearing your mask properly. The areas that we really want you to protect are your eyes, your nose, and your mouth. So a lot of people use a chin mask or a mouth mask, and that's just not giving you the protection that you need. You need to ensure that the mask is on from the top of your nose down to the bottom of your chin at all times. It's something that, as health teams all over the world, we are used to it. So it's something that everyone can get used to keep the mask on at all times. Yeah. Avoid touching your face, rubbing your eyes, especially if you're at the workplace, etc. Keep your hand sanitizer with you. We do know that the hand sanitizer and soap and water kills the virus. So as much hand washing as possible, and as well as using your sanitizers and social distancing. So the mask alone it's not the solution to everything. You've got to ensure that you keep your 6 feet away in the workplace, and even at homes. If you feel that you have started with a little cold, etc., wear your mask at home. Protect your family at home as well, and try to reduce any kind of socializing at home.
Yeah. Can I just add there, Dr. Diaz, before we go any further, proper masks are also important, because I see a lot of people using neck gaiters. And the masks with the what do you call it? The vent
filters.
Yeah, with the vent where all your air comes out. And I think they think they're being safe, but in fact the science says it's not.
Yes. No, the vent mask doesn't really protect the other person. Yeah. It'll just protect you.
It lets all your air out.
That's right. Yeah. So it doesn't protect the other person. So it's important. Yes, absolutely, wearing the proper mask as well. And not using like you had, I don't know what it's called, but the cloth ones that sometimes
the fisherman scarf one, rash guards.
Yes. Those aren't effective as well. So you can use your cloth mask in the home environment, and there are some that has filters inside them as well. They're the surgical mask as well. So using the proper mask is very important, and using it properly as well is even more so important. So I was just going to say that for employers as well, it's important that even after you've closed your doors and you don't have the public in your establishment, ensure that the staff in the establishment keep to these protocols as well. Because many times we feel that if we know someone well, or if there are friends, etc., we can let our guard down. But it's always important to keep your mask on, keep your social distancing, hand washing, avoid eating in lunch rooms, etc. Avoid doing that. Trying to stagger staff to eat separately, or going home to eat. Things like that will really help us to reduce the spread.
All right.
I would also just want to take the opportunity to really echo what Ms. Lorna had said a little while ago with regards to thanking our team at the Ministry of Health and Wellness. It has been, as I said in the beginning, a very challenging year. Our team has really been flexible, been able to learn very quickly about this virus. We had to do lots of trainings in even doing the swabs, interpretation, health education. So in the surveillance aspect and in the health facilities, we are very grateful for the team approach that the Ministry of Health and Wellness has taken over the last 12 months. It takes a team for us to address this virus, and for all of us to be working together. So I just really want to say a very big thank you to our team on the ground for being so supportive, flexible, and always there to cover all the shifts 24/7 in all our districts.
And we want to say thank you, of course, to the entire team that is there. And you're absolutely right. We talk about the frontline workers. We talk about our nurses and doctors and people in the healthcare system. But there's so many people working within the ministry, from collecting data to outputting data and so much other roles right there. And we do appreciate the work that you've done. all the best, and of course, we'll keep this conversation going in 2021.
Absolutely. Thank you so much for having us.
Stay safe, everybody.
Thank
Okay.
you. You too. Happy
Bye-bye.
New Year's.
Happy
Thank
New
you.
Year.
Bye.
Yes. Bye-bye.
All right.
And there you have it, of course. And with that, we are going to be taking a break. And when we come back, we are shifting gears. And we're going to be talking about how you can prepare some New Year's treats for your New Year's party at home this New Year's Eve. So please stay tuned if you want to find that out.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.